So would you recommend for all women to check their AMH?
Yes, so essentially I recommend everyone from the latest age of 25 or so to check their AMH and AFC twice to establish their egg reserve, baseline egg reserve. So let us say if their AMH and AFC is low, and they can actually look at the chart and say when actually it's going to hit very low levels or hit zero. So then they can make a plan. So then let's say if they have a very high egg reserve, like in PCOS, then they don't need to worry. Probably they don't even need to check AMH and AFC again, because the egg reserve will be there for the next 10 years, 15 years or longer. So if they have average egg reserve, they don't need to worry too much. Maybe after 3-4 years, they can recheck and just revisit this question of fertility. So fertility monitoring doesn't necessarily mean just doing the test. Let us say when you do test AMH or AFC, you know your egg reserve at the time, plus you revisit consciously, you revisit the question of fertility. You start thinking about fertility. You start making plans about your fertility. So, but let us say at the age of 25, you did AMH, which is like 5, and you did antral follicle count 7 or 8. Then after a few months, you repeat AMH. Next time AMH is 6, for example, then antral follicles 8 to 10. So both tests 2-3 months apart saying same thing. You have a low egg reserve. So if you don't take an action after like 4 or 5 years, it will be critically difficult, maybe even impossible to have a child. Which means next 4 or 5 years, you need to complete your family. You can have a kids trying to conceive naturally, or you need to preserve your fertility by freezing your eggs or freezing embryos using donor sperm. So, and if you do that, then when you're ready to have a kids at the age of maybe 35, even 40, you don't need to go through such a stressful fertility journey. And usually, if you ignore this is a group of women who actually need donor eggs. So when you do that, in the future, if this introduced as a policy in most countries, most women do not need donor egg. Why? Because they act as a donor for themselves. So the younger self, the younger eggs, will be donor to their older self. So yeah, so generally, I encourage all policymakers in healthcare and fertility around the country, around the world, to introduce AMH and AFC, which is pelvic ultrasound scan and AMH test, as a fertility screening test and fertility monitoring test. For example, we have a cervical screening test around the world, in most countries introduced. So they start from the age of 23, 25, and you do cervical screening to establish whether you're at risk of having cervical cancer. Similarly, you can introduce fertility screening for all women across the board by introducing AMH and AFC tests. So let us say you do AMH and AFC twice at the age of 25, and depending on the result, if your result is low, then you ask these patients to consider starting family early or fertility preservation by freezing eggs or embryos, or monitor their fertility by doing AMH and AFC tests after a year or 2 years, so that they're aware of their fertility and they're consciously making the plans addressing possible future fertility problems. So if they have a high egg reserve, then you can be assured probably they don't need to repeat AMH and AFC again. If they have average egg reserve, they may need to revisit after 3-4 years and repeat AMH and AFC just to monitor and review their fertility plans. So in the future, if this happens, we do not have today's level of fertility problems, which means a lot of women do not have infertility, because by the time they run out of egg reserve, they already completed their family. A lot of women do not need the repeated IVF treatment cycles. Why you need the repeated IVF cycles? Because you're not producing sufficient amount of high-grade eggs or embryos. So maybe you have a low egg reserve. In IVF, you're producing only 2-3 eggs, and they're of poor quality because you're older. So if you already frozen a lot of eggs and embryos when you're young, then in the future probably you don't have this level of fertility problems like we see. So infertility is epidemic. Yeah? So when 15% of population suffers from the condition, it's level of epidemic. Like 1 in 6 person suffers from infertility. One of the reasons is exactly this. We are the women starting family late when the egg reserve is too low or absent, or egg quality is too low. Eggs are critical element of female fertility. Quantity and quality is very important. When you're starting trying to conceive, when quantity is very low, quality is very low, then you are likely to have problems. So yes, for healthcare policymakers, I recommend introducing AMH and AFC as a fertility screening and monitoring tool from the age of 25 for all women who want to have kids in the future, to do AMH and AFC at the age of 25. And if their levels low, make a plans. Levels high, you don't need to worry. Levels medium, then you need to review by the repeating tests and few years down the line.